everybody. Recording live from somewhere. This is Zach Couples with episode number 142 of the Movement Debrief. And today, folks, it's going to be a head turner because we're going to talk about lower cervical rotation. Yes, folks, rotation of the head is not just your head moving. There's a lot of components into it, and learning about how the lower cervical spine and upper thoracic spine is involved with rotation can be a really cool way to bridge the gap between stuff up here and stuff down low. And the reason why I'm going to talk about this topic today with you beautiful, sexy, outstanding people, folks, is because the Zach of the matter is your boy, Big Z, has got a bunch of questions that have been asked by the people. They will be answered for the people by this people right here. Fam recognized fam. Without further ado, let's debrief, shall we? The first and only question today, so it's a doozy, has been asked by my dear friend, Henry. And here's what he asks. Hey, Zach, what do you look for when you assess neck rotation and needs for lower cervical rotation? Awesome question, Henry. I've spent a large amount of time over the last couple of years focusing on here down. It's something that I kind of quit doing for a while. And I think the reason why that is because I felt like I would jump to neck interventions or, some of the more esoteric stuff way too soon before getting into this. But as of late, I've been diving into it more because I think there are a better understanding that I have of testing the cervical spine now that I didn't in the past. And I think it is a really important area to look on, especially if you have someone who is really insanely flexible in the thorax and you can't really trust the measures there. So let's dive into cervical rotation. If you grab yourself a neck, make sure you protect your neck when you do. When you rotate the head to the right or to the left, you're going to get about 75, 90 degrees of rotation, somewhere around there. About 45 degrees is going to come at C1, C2, the AA joint. And the way you can assess cervical rotation in the upper cervical spine, C1, C2, would be the Flexion rotation test. I'll link a good video of the Flexion rotation test in the show notes, which will be found on zachcouples.com/lower-cervical-rotation. You'll get access to the HD sexy version of this. You'll get the podcast, and you'll get a blog that outlines all the good stuff that we talk about today, as well as anything else. With the upper cervical rotation test, the Flexion rotation test, all you do is you take someone's head, you bring the chin to the chest, and then you just rotate the head either side. Ideally, you should get about 45 degrees. If you get too little, then you might need to do things to improve upper cervical rotation. If you get too much, that could indicate that that person has a severe restriction in the lower cervical spine, or they've have a super duper eccentric bias in the posterior part of the upper cervical spine. So let's say you've assessed that. Cool. Well, Zach, you've only explained about half of the rotation available with cervical rotation. How do you explain the rest? Well, I'm glad you asked. The rest of cervical rotation happens from C3 all the way down to about T5. So when I turn my head to the left, all of the spinous processes from about C3 down to T5 will start to rotate to the right. We need some testing to indicate how well I can rotate in this area. The lower cervical rotation test is a way of doing that. Basically, what you're going to do is you're going to grasp the neck as a unit with your index fingers resting at around C7-ish. Basically, you're going to grip the neck on either side, and rotate it left and right. The reason why I dislike this test, or what makes it tough, is you can't really rely on degrees to know if it's full or not. It's kind of a feel. But essentially when you grab the neck and you rotate it to the right and to the left, you'll just kind of feel an abrupt stop, many times going to the left for most people. And what this test indicates for me, if it's more of a lower cervical focus, is it's a last check to make sure that I have upper thorax expansion. Because remember, when I rotate the head left and right, I'm going to get motion all the way down to T5. And sometimes you'll work with someone who has full shoulder flexion, and it always seems to be someone like a really flexible female. That's like every time that I've seen that, someone who's got just really goopy shoulders. They'll have full shoulder flexion, but then you go to check lower cervical rotation and it's restricted bilaterally. This is a nice check for those people. Good rule of thumb, anytime you have someone who's really flexible, a lot of times if you go to an axial skeleton measure, whether it's infrasternal angle, whether it's trunk rotation, whether it's lower cervical rotation, that's a great way to really confirm or disconfirm if that person truly has the ability to expand in that area. That's when I will go to this as a measure. What is it telling us though? Rotation in general, if I'm rotating the thorax, if I'm rotating the pelvis, is a great way for us to understand if someone can create anterior expansion on one side and posterior expansion on the opposite side. Suppose that I'm rotating my head to the right. If I rotate my head to the right, if we look at the back side of Ted, when my head goes to the right, the spinous processes are going to move to the left. If the spinous processes move to the left, you're going to get concentric bias of stuff on the left back side. And I'm going to get eccentric movement or bias of stuff on the right back side. If I have eccentric action on any side, that's going to allow for more expansion. Just like if I flex my big old bicep, hang on. If I flex my big old bicep, I'm going to get concentric stuff on the front side, but then the back side of my elbow has to eccentrically bias. So stuff is going to be able to go here, aka the synovial fluid. Because when this stretches, we also get stretching of the joint capsule, connective tissue, among other things. Go ahead and check it out one more time. Now let's apply that here. If I turn my head to the right, I'm going to be able to get expansion on the right posterior quadrant because stuff on the back side is stretched out to allow for right cervical rotation. I will also get left anterior expansion capabilities. And the reason why that is because when I rotate the head to the right, stuff on the back is more concentric, but you're still going to breathe and do all types of stuff here, which will allow for the anterior expansion. Because if I block the front, that's going to push stuff forward, hence expansion in that area. Now, it might be a little visually confusing because, well, okay, Zach, it makes sense that when I do the same thing in the pelvis, I rotate the sacrum to the left, I'm going to get movement of the viscera, aka the guts and the goods, in those respective directions. So things are going to move there. And it might also make sense in the thorax. Okay, Z, I'm rotating the thorax to the right. I could see how I'm going to be able to put more air into certain parts of the lungs, more so than not. But what the heck do I have that's going on in the neck that would be expanding and compressing? You got your airway. That is the major key. So you have your trachea and the upper airway. That is what gets relative expansion and compression. And you'll be able to see this structurally on some people when you look at cone beam 3D CT scans in the neck. You might be able to see A to P compression or A to P expansion of the upper airway. So that's what we're creating expansion and compression of. It's still air. Now, the cool thing about lower cervical rotation is it's another fact check for upper thorax expansion, because if I can create expansion in that area, I can probably free up the lower cervical rotation, because these things move as a unit. How would you go about improving expansion in this area? Again, I'm glad you asked. Moves that I like would be anything that creates rotation in this region. So from an upper body perspective, if you do something where I'm rotating, I'm reaching forward, but I'm keeping my head centered, that's going to drive rotation into the uppermost parts of the thorax. So cross connects, like a cross connect walk, where I'm rotating the thorax, in this case to the right, and I turn my head to the left. Well, when I do that, that's a left cervical rotation. Can you see that? I have to, because if I rotate everything to the right, in order for me to look forward, I got to turn my head left. When I do that, essentially what that does is, so I'm rotating right, I turn my head to the left. That's going to give me an isolated posterior expansion on the left-hand side, because I got left rotation happening. So doing things where you're rotating the thorax one direction and turning the head the opposite is a great way to create expansion, in this case the left posterior area. So this would be a great way to expand the upper thorax. So if you need uppermost thorax expansion, turn the thorax and spine one direction, look the opposite direction. Another great way to do that would be a side-lying arm bar. This could be a cross connect, anything that involves that. You could also throw in movements of the humerus and cervical spine simultaneously. A arm bar with a screwdriver and a head turn is a great way of doing this. So if I'm reaching forward and I ER my humerus, that's going to create, let's say on the left, that's going to create left posterior expansion. And then if I turn my head to the left as well, that will also create left posterior expansion. And those are predominantly the ways that I increase lower cervical rotation. Your options are either turn the humerus and the head at the same time, or orient the thorax one way, look the opposite. And if you do those, you're going to create the rotation needed to restore lower cervical rotation. So let's say you've done that. Let's say you've improved lower cervical rotation, and now you need to go upstairs. How do I go about improving upper cervical rotation? Well, this is where I find disciplines like myofunctional therapy or even vision therapy or visual exercises a bit more useful. Doing things to attain a palatal tongue posture or to work on different visual skills can be a great way to restore those modalities, because the more you have to go up in the neck to change range of motion, the more likely you are to involve various sensory systems within the neck. Or, how about this, folks, the more those things have a contributing factor to the limitations that you might be seeing. But I've gotten great changes by doing various myofunctional exercises. If you want to dive into that, I have posts that outline myofunctional therapy, as well as on my YouTube channel, there's a myofunctional exercise playlist that you can go ahead, check out, and mess around with. Basically, with myofunctional, you want to attain a palatal tongue posture, which involves the whole tongue goes up against the palate, and then there's various skills that you can practice to improve rotation in that area. I can't really dive into the skills that are needed visually to improve that, because, well, one, I'm still learning in that area. But if you work with a neurooptometrist or a behavioral optometrist, there's a great website, covd.org, that can give you access to a lot of people who practice in that regard. That is an amazing way to elicit some changes in upper cervical measures. I don't know if I've mentioned this to y'all, but I've been going through vision therapy for the last couple months, and I was dealing with some neck issues, Like if, let's say the fam, let's say I IG lived and I put everybody on the left-hand side of me as we're at dinner, and I got to look and talk to you wonderful people throughout dinner. By the end of dinner, your boy's neck was hurting. That seems to be a thing of the past since I've started vision therapy. So I want you to know that it is an influence, and sometimes you might have to go there if there are some restrictions noted in that area. But let's say you haven't dived into myofunctional therapy. You haven't dived into vision therapy. What in the hell can I do then about upper cervical limitations? Well, working on things that involve OA extension or OA flexion, depending on what you need, can be effective. Like and you're doing this in your exercises, you just might not be aware of it. For example, the drunken turtle, one of my favorite moves, if you can get all the way to where you're getting most of your back off of the ground on that particular move, you're working on upper cervical flexion. You're essentially forcing it into that position, which is not a bad thing, especially if you have someone who's got more of a forward head position. You're going to need upper cervical flexion. Or if you got that person who's got the military posture, you might need to drive OA extension. And ways you can do that would be just making sure that when someone's doing some type of reaching activity, one of my favorite cues is that they undouble chin themselves. Not necessarily get a forward head, but just making sure you drive a little bit of head movement without tipping the head backwards or jutting the head forward. Working on just that positioning with the moves that you're already doing can help free up neck positioning in the upper cervical spine, and just that alone can drive upper cervical rotation. Manual-wise, doing soft tissue mobilization to the upper cervical spine can be great. And also, I've gotten changes with joint manipulation. I finally took the time, because they don't teach you this stuff in PT school, at least with us. But I took a manipulation class through the Spinal Manipulation Institute. Check them out, because I think they got some good offerings. There's some great joint manipulations that you can perform in that area that have led to profound changes in upper cervical motion. I think it's a polarizing technique, but it is an effective technique for improving range of motion in that area, especially if you got someone who has a difficult time differentiating OA motions. I would check it out. I think it's awesome, and I think the way that they've positioned the evidence. Now maybe someone argued I got bamboozled by the evidence when I took dry needling, but whatever. You probably haven't read all the articles, but the evidence that they present, and I feel like even though they're obviously trying to make money off of this, they present a balanced look on the evidence. The risks of manipulation in that area are actually quite a bit lower than you would think. There was a cool study that they talked about where, because the concern when you're manipulating upper cervical spine is a vertebral artery decussation, and they compared like a few different disciplines, and chiropractors, though is the scare is you're gonna, screw up the vertebral artery by a manipulation, but they compared chiropractors to primary care providers, and you actually had a greater likelihood of having a vertebral artery decussation by going to your PCP than a chiro. Now, that doesn't mean that we're going to avoid PCPs. So neither here nor there, though. I'll talk a little bit more about it when I review that course. But I think, don't discredit manipulation. So we talked about how to assess cervical rotation. We talked about what you're going to do about it. But folks, I'm sure a lot of you wonderful people are working with people remotely, and a lot of the tests that I asked you to do, well, those are a bit more passive motion in nature, or maybe you're someone who can't touch your patients for whatever reason, or your clients. Maybe you are a coach of some sort. Is there a way to assess cervical rotation? Yeah. Things that I do is I just watch people turn their head in the seated position. That's a great way to see if someone can move their neck. And then you can differentiate it by having them do the flexion rotation test, but do so in sitting. So you could have them go down, turn the head left and right, see how well they do. And then you can compare the difference in that motion versus just the seated one. If you have someone who's limited in cervical rotation with them just sitting upright, and then you have them go to the flexion rotation test, and that looks full, as in they can hit their 45 degrees, or maybe they're hitting 60. That's probably a good indicator to let you know that they might have a restriction in the lower cervical spine as well as the upper thoracic spine. You can also look at shoulder flexion to corroborate your findings. If someone, let's say I have someone who is limited in left cervical rotation, you have them try the flexion rotation test, and it's full. And then you have them try shoulder flexion with an ER bias, and that's limited on the ipsilateral side, meaning the left-hand side. Chances are that those are indicators that will let you know this person needs expansion in the upper thorax, lower cervical spine. And those would be the hashtag major keys. DJ Zach Lid, what you gonna do about it when it comes to cervical rotation? To summarize your amazing, sexy question, Henry. Cervical rotation, you got upper and lower components. It goes all the way down to T5. To check the upper, flexion rotation test. To check the lower, do a total spinal rotation or a total cervical rotation test. I'll link it in the show notes. Check it out. That can let you know if you need to expand in which area. If you need lower cervical, upper thorax expansion, think about rotating the spine one direction, cervical spine another, or combining humeral and cervical motions to elicit expansion in those respective areas. If you need upper cervical expansion, think soft tissue, think OA extension or OA flexion, depending on what you need. Think about myofunctional therapy and vision therapy as potential things to try out to improve rotation in those areas. And if you do those things, you ought to be in business. Bell House Fitness, aka G-Easy. How do you know if vision is a limiting factor in cervical movement? That's a great question. I don't necessarily have a if this, then this, then this. A lot of times if someone has a past medical history or a current medical history that would indicate visual issues, that could be a way to think about pursuing this, but really it's a process of elimination. So even if someone has some visual stuff, if you've got them to stack, you've taught them to shift, you've done some things to create expansion in the upper thorax and there's still issues, then you're starting to think, I might need to go upstairs. Things that I would consider pointing towards going to an optometrist to improve upon this area. If you got someone who's got a very high plus or minus in their prescription, like -4 or even -8 or +4, +8, that could probably indicate going to see a optometrist. If you got someone who's got a history of strabismus or lazy eye, concussions. One of my physical tests is if I got a straight leg raise that is unchanging for some reason. That seems to be a potential indicator that there's a visual issue. Cataracts, anything like that. Or if someone has had LASIK and or they've got monovision, that's LASIK or PRK. And again, let me preface this. You've done everything else and there is no change. And you've coached the snot out of it because it's not a matter of, well, I tried stacking and it was kind of okay, but I'm going to jump to vision. No, don't do that. Because I've done that and it went terribly. Make sure that they've mastered those other skills first. I think that's a good stopping point for us today. And I want to thank you all. This is going to be the last debrief of 2020. Because of the darn holidays. I don't know if y'all have seen the movie Prefontaine, but the discus thrower in Prefontaine, he's like, well, I hate Christmas. Anything that throws me off my routine. I kind of feel that way in some respects. And also, too, because my birthday is right before Christmas. And, you know, Santa Claus be stealing your boy's thunder all day, every day. So that's okay. I'm not bitter or anything like that. Talk about it in therapy maybe. But I want to thank you for an amazing year in terms of interacting with you. I know it's kind of been a terrible year, but I appreciate all of you supporting me and tuning in, and hopefully you're getting a lot out of these debriefs. If you have any questions that you want on the debrief, please slide them to my DMs or go to zachcouples.com and go on go there, find me and email me or talk to me somehow. But you've been an amazing group of peeps. If you want to learn more, 2021 is around the corner. And you know what else is around the corner, folks? Human Matrix, my seminar, because you might be thinking, okay, you talked about improving rotation, but I don't even know how to create expansion into the upper thorax. Or maybe you're like, oh, I can't really stack, but I want to talk to you. Well, you can talk to me at my live seminar because if the COVID God shine upon us, is going to happen, and I'd love to see you there. Places that it will be: February 20th and 21st in Atlanta, Georgia, where the players play. That is going to happen, folks, unless there's any major changes. But, I talked with the peeps there. COVID-wise, things seem to be going well. And we'll do all the precautions to keep you safe. So Atlanta, Georgia. April 10th and 11th is Warren, Ohio. May 29th and 30th is Boston, Massachusetts. August 14th and 15th, Ann Arbor, Michigan. September 25th, 26th in Wyckoff, New Jersey, outside of New York City. November 6th and 7th in Charlotte, North Carolina. I'm working on a couple others. I know there's a few that I have to reschedule. It will happen. If you want to sign up, go to zachcouples.com to do that. There's also other services on zachcouples.com, aside from the blogs and the rest of the debriefs. Online movement consultation. If you're like, man, Zach, my neck is stiff as all hell because I've been computerizing because of this darn COVID thing and I need some help, your boy can help you out, because what we'll do is I will take you through a full movement assessment, all virtually, COVID-free. We can even unmask. It'll be really cute. But we'll do that. I will run you through a full assessment. I'll coach you right on the spot through some moves. We'll get you moving and grooving, get you in business. Maybe your neck's feeling good and you're like, cool, Zach, you loosened me up with those moves, but I want to kick it up a notch, Emeril Lagasse style, and I want to get gains or losses, or maybe you just want to get stronger, or maybe, folks, you want to develop a baseline of movement that will allow you to do everything you want to do. Maybe you've tried back squatting and it just doesn't feel right. Perhaps the reason it doesn't feel right is because you have a hard time bridging the gap from these lower level activities onto the training side. Well, you're looking at a gap bridger right here, a bald one at that. Work with me through training, because I can take the movement consultation, apply it to a training program where I will coach you remotely, and we will have your fitness gains at the next level. Perhaps you're wondering, how can I do this with my Supreme clientele? That's where the mentorship program is useful. We can work through didactic stuff via a Zoom call, and then I'll give you some homework, I'll give you some feedback and pointers on how you're coaching and implementing this stuff with your peeps, and we'll get your coaching skills to the next level. Once you've scoured zachcouples.com, you've subscribed to the newsletter, you've read every blog I've ever written, and you're probably wondering, well, what's next? Well, I got an answer for you, folks. The next place to go is Apple Podcasts and Stitcher and search The Zach Couples Show. Because guess what, folks? There's 141 other debriefs out there. And didn't always have two cameras. I was always bald, but I wasn't always lean. You don't want to be there for the fat Zach era, trust me. So just listen to me instead. Take me on a long car ride. And while you're there, leave a review so the fam can keep growing. I'm also on the social medias. Facebook and Twitter is Z Couples. That Instagram, baby, is Zach, Z-A-C, Couples, C-U-P-P-L-E-S. And the last place you can find me is YouTube. Folks, if you want a gang of exercises to implement with your people to improve range of motion, you want to fine-tune your squat technique, or you want to know, okay, Zach, I saw this move somewhere, but I don't know when in the hell to use it or how to coach it. YouTube will teach you how to do that. Thank you so much for tuning in. You've been a beautiful, sexy, outstanding audience. Here's to a better and brighter 21. Drink my live probiotic soda for you. And then once I've swallowed that live probiotic soda, I want you to keep it real but not to the extent where things go wrong. Stay hungry, stay learning, stay moving. And I'll see you next time. Deuces.